Hello, everyone. Hello. Um, it's 5 minutes and yes. Hi, everyone. Okay, I think we can start. Good afternoon, everyone. Good afternoon and warm welcome to today's ADAT course webinar. I am Ali Reza from Confidentist, and it's my pleasure to have you here today. On behalf of Confidentist Group, I'm thrilled to have you all join us. But this is not just another webinar. It's an interactive learning experience designed to, keep you engaged and involved. Today, we are diving into one of the main subjects in ADAT, biostatistics. You will get experience with real ADAT style questions, giving you a chance to actively participate and sharpen your skills along with other information, valuable information. And, we are honored to have Dr. Hannah here. She has successfully passed AFK and ADAT and with the best scores. And now, as an instructor in ADAT and AFK, is cooperating with us. This is a fantastic opportunity to learn from someone who has walked this path and succeed. Okay. And she will start. And after the first part, I'll be back to share some key details about your course feature and how we support your ADAT journey. Once again, thank you for being here, everyone. Dr. Hannah, the floor is yours.
Thank you, Alireza. Hi, everyone. Let me just quickly share my screen. Here we go. If you could just confirm in the chat that you're all seeing my screen. Perfect. Okay. So if you can just scan this QR code with your phones, I would like to get to know you a little bit before we get started. I know some of you have already taken the AFK course and the AFK exam, and you're joining us to know what's the next step. And some may be new to Confidentist, so I just want to kind of get an understanding. All right. Let's see. So I'll just wait for a few more minutes, hoping to get some answers here. All right. So all of you are taking ADAT for the first time. You're hoping for a score above 600, which is great. Yeah, so let's get started. Today's agenda. So I'm going to talk a little bit about what ADAT exam is and the key steps in registering for this exam. There are details that I'm not going to go into, but I'm always available if you have questions, whether it's about registering or about preparing for the exam. I'll just quickly go over it. Then I thought it's a good opportunity to really get started today, because you've already made the first step. You've registered for a course, for a webinar to get to know more about ADAT exam, and I think that's a good first step. And so I want you to get started today. We'll start by looking at some biostatistics questions. I'll walk you through their answers, depending on how much time we have. And it'll be just like a quick peek into what is offered in a Confidentist course and what kind of question you can expect on ADAT exam. Then with the help of Ali Reza, we're gonna introduce the course that Confidentist is offering for ADAT, and then we'll have some time to answer any questions you have. All right, so ADAT exam, you can take it from March 1st to August 31st. That's the window that you can take this exam in. Of course, you have to decide when to take this exam based on which universities you want to apply and their deadlines, their application deadlines. To give you an example, McGill University's deadline has changed this year to March. U of T deadline is in early summer, and most other Canadian universities that require ADAT exam are at end of summer, their deadlines. You can always look up these deadlines on the website of universities, but just so you can plan when to take this exam. It usually takes 1 or 2 weeks after you take the exam for you to have your results. And in order for you to not get anxious, I would recommend taking it at least 3 weeks before the deadline of the universities. ADAT exam has 3 main parts. For those of you who've already taken AFK, the clinical sciences part is going to be the easiest one. So you'll have 80 questions in that section. If I were to compare ADAT exam with AFK exam, which is a question that I most often get asked, is that AFK questions go really into details, details that may not be applicable necessarily in the clinic, in your practice as a dentist. Whereas ADAT exam really wants to assess if you are a good clinician, if you know what is necessary to be a good clinician. So you won't really be surprised with questions in the clinical sciences if you're already confident in your clinical skills. That being said, the format of the questions compared to AFK is a little bit different, hence why it's important to get to familiarize yourself with the type of questions that are going to appear on ADAT exam. For example, you will have more case questions where you are presented with a case history, radiographs, clinical photographs, and then you're asked questions about that case. You do have these kind of questions on AFK as well, but they're more common on ADAT. The second part is the biomedical sciences part. I would say this is the part that you need to put your most effort and most focus into. A lot of questions in this section are very detailed in biochemistry, in physiology. You really need to have a deep understanding of physiological mechanisms that you may have studied in the first and second year of your dental curriculum. So it has been a while since you've graduated and since you've studied these topics, so you will need a strong refresher in these areas. And then also the third section is a biostatistics part. This part, I would say, most of the questions that appear on ADAT exam are interpretation kind of questions, right? So, for example, I know one of the most common resources that people refer to for ADAT exam is Knockout. It is a great resource. I have personally used it, but most of the biostatistics questions on the Knockout app are calculation-based. So you just have a formula, you plug in the number, you do some calculations, and there you go, you have the answer. From my experience and from experience of the applicants that have taken ADAT and the instructors that we have in our course in Confidentist, these are not the questions that you will see on ADAT exam. Most of the ADAT questions in biostatistics, as you will see a few examples in this webinar, are going to be gauging your understanding of basic concepts in biostatistics. And so, as you can see in this table, I've copied this table from the ADAT Examinee Guide. You can download that and go into details of it, but this is the basic summary of the exam. This, I took it from official ADAT report of 2024. This is the mean score of everyone who took ADAT. You know that some people take ADAT to apply for residency programs in US, and some people like us take it to apply to equivalency programs in Canadian universities. So this is all of those people. And you can see how the scores are distributed here. And the people who answered to my survey in the beginning of webinar, they're aiming for above 600, which is a very reasonable goal because most Canadian universities, the competition is high. They're looking for the best of the best. So you are aiming for this part, above 600, maybe above 640 even. So you can see that just knowing some sample questions, just knowing the summary is not going to be enough to excel in this exam. You don't need to do good at this exam. I would say 500, 520, 540. These are all very good scores. These mean that you have a basic understanding of most topics, but it's just not going to be enough to get you into Canadian universities. So this is where we're aiming for. Moving on, any questions so far? Anything that you can put in the chat and I'll get to it. Let me just get back to my chat here. Of course, good question, Paradise. I'll get to this question in the Q&A. If I forget, please remind me at that time because it's an extensive question. Okay, so moving on, a lot of people message me about how to register for this exam. Of course, we're happy to help you on a personal basis. If you have questions, you can just send it directly to me or Ali Reza, and we can help you walk you through the registration process. But just to give you a summary, the first step you need to do is to apply for an ECE approval. You will need to send the ECE approval of your dental degree to the Joint Commission of the Joint Commission that supervises exams of INTBE, ADAT, and other exams. So, and the type of report that you will need, because I get asked this question a lot of times, is course by course. So you need a course by course report of your dental degree to be sent to this Joint Commission. It won't take too long. I know a lot of you have gone through the NDBE equivalency process. It takes a long time for them to process your documents, but ECE is pretty fast. I would say around 2 to 3 weeks is usually enough to hear back from them. So that's your first step. Once you have that, so this is what the report looks like. This is my report. I put this here so that you can also appreciate my GPA. There is a range to the GPAs that get accepted into Canadian universities. I would say if your GPA is not as high as your competitors, you shouldn't give up. You should just focus all of your energy, all of your motivation in getting the highest ADAT score that you can. I have classmates in the program that I am currently enrolled in McGill that don't have the highest GPAs, but they have done very well on ADAT exam. So the universities usually take into account both your ADAT score and your GPA. So if you're lacking in one, you can compensate with the other. So this is the report you will get from ECE, and they will directly send this report to ADA. Second step is that you have to go to ADA website and create a dent pin. This is a relatively simple step. Once you have your dent pin, then you will go and register for your ADAT exam. I've put a few screenshots of the most frequently asked questions. A lot of people say, what do I put here? What do I put there? You can just take a screenshot of this slide if you want. These are well, of course, that's my graduation year. It's going to be different for you, but you're going to select dentist, graduated of a non-accredited dental school. And these are the answers that you're going to put in there. Second, you're going to pick ADAT as the exam that you're registering for. Once the first time you're registering for ADAT, any university and program that you choose to have your results sent to will be free of charge. So I would recommend going here, clicking this, and clicking everything else as well. And then on the next page, since you've clicked everything, it's going to bring all the universities that have those programs. Again, go ahead and select all, because if later, you never know, you find a program in a certain university that you're interested in. If you want to send your ADAT score to that university after you've taken the exam, after you've registered for it, there's going to be a $50 USD fee for it. So just go ahead and click everything because there's no fee for it. And that's it. That's about the registration here. Yes, you will go to answer your question, Paradise, you will select the US one. I think, Hajra, if you've already gotten the basic one, to be honest, I don't know. All of us usually recommend to go for the course by course option. Personally, I wouldn't risk it. I would go and apply for a course by course one, just so that you don't get delayed in your process. But yeah, sorry about that. All right. Okay. Moving on. So these are just to tell you a little bit about myself. These are my ADAT scores. And I put this slide just to tell you that if you put your focus and energy into this exam, high scores are achievable. I was working full-time while studying for ADAT. To just give you a brief summary of my journey until now, I took AFK in February of 2023. 2024. Then I took INDB in March and took ADAT in May. So I had 3 months between my AFK and ADAT, 3 to 4 months between my AFK and ADAT to prepare for this exam. And I studied a lot, long hours, but these are the results. It paid off. So it is possible. It is a tough journey, but you can do it. And we'll be here with you. And so I got into McGill and U of T, and I chose McGill because I love living in Montreal. And here we are. So if you don't have any questions so far, I think we've done very good with the timing. I'll have a few minutes to go over some biostatistic questions with you. Dr. Patel, I will go to the first page. I think you mean, which page do you need? If you want to take a screenshot, this one you mean? How many hours do you think you need to study? That really depends on the individual. I would say as many hours needed to really be confident in your knowledge of basic science. It's different for everybody because different programs have different, some programs put a lot of focus on biomedical sciences in your dental school, So you might have a stronger background than your competitor. Some people have graduated recently, so they remember these concepts from dental school and some don't. Also, it's like a rote memorization, the basic science. So it just depends how good you are at memorizing information, really. So just you have to figure that out for yourself. Okay. All right. So let's do some biostatistics. I know it's not the most fun topic, but I'll try to make it a little bit fun. All right. A recent study addresses the role of sugar consumption in tooth decay development. 200 children diagnosed with caries and 400 caries-free children were asked a series of questions regarding their dietary habits. A sugar consumption index ranging from 0 to 10 is then calculated based on their responses. The mean sugar consumption index for children with caries is calculated as 4.5. 95% confidence interval is 3.2, sorry, that's a typo, 3.2 to 5.8. How would the following statistical parameters change if more children with caries were included in the study? This is what I mean when I say that ADAT biostatistic questions are not just formula and calculations. They just want to know if you know what confidence interval means, what 95% confidence interval means, and how will that change, you know? So I'll try to explain this how I understood it. Confidence interval of 95% means that we are 95% sure that the value, the average of that population falls somewhere between 3.2 to 5.8. The average we have calculated from our sample of 200 children and 400 caries-free children is 4.5. But how accurate is this? Well, we estimate with a 95% confidence that the mean of the population, the general population, will fall between 3.2 to 5.8. So what happens if I recruit more children to the study? Well, logically, you will have a more accurate estimate, right? So what will happen to my upper confidence interval and lower confidence interval? My confidence interval window will shrink. So those numbers will become closer together, right? I hope that makes sense. So in here, your upper confidence interval will go lower. Your lower confidence interval will go higher. And then what is that other number, the standard error of the mean? This is the formula. There will be some formulas that you will have to memorize for your biostatistics. Not a lot of them, but this is one of them. So your standard error of the mean is your standard deviation divided by your number of your samples. So if you just plug the information in the question to this formula, you'll see that if I add more people to my sample, meaning this n will go higher, then my standard error of the mean will go lower. That's one way of answering this question. The other way is to just understand what standard error of the mean is really. Standard error of the mean means how different is the mean that I have calculated from my sample, from how different is that from the mean of the population, of the general population. So the more people I add to my sample, the more accurate my calculations are going to be, the closer that mean is going to be to the general population's mean. So my error of the mean is going to be smaller. I hope that makes sense. Obviously, I don't have all the time here to explain it, but we'll go over all of these questions in more details in the courses. Just want to kind of give you an idea. Like, I don't expect you to understand all of the questions and the answers. Just want to give you an idea of how you should be preparing for this exam and what we offer in our course. Let's do another. Should we do another, or how are we feeling? Is this still overwhelming? Okay. All right. A new test to diagnose periodontal disease in patients is being assessed. The comparison gold standard is a positive periodontal and radiographic exam. The results are given below. What's the test's specificity? So again, I'm pretty sure you've studied some biostatistics for AFK exam. You probably know the formula to calculate sensitivity, specificity, negative predictive value, positive predictive value. But just so you know what they actually are telling you. Like if I tell you, oh, your test is specific, but it's not sensitive, or vice versa, what am I telling you really? So when we say a test is sensitive, we mean of the people that are sick, of the people that test positive in our gold standard, how many is our test able to detect? So if we have a total of 40 plus 160, like 200 people who are actually positive for periodontal disease, our test is only able to detect 40 of them. So the sensitivity of our test is not that high, it's 40 over 200, right? And then specificity is of the people who are negative, of the people who are disease-free, how many is my test able to detect as disease-free? So how many people are disease-free? 180 plus 20. We have 200 people that are disease-free. How many were my test able to detect as disease-free? 180. So the test is pretty good in specificity, right? So it's going to be 180 over 200, pretty high. And that's always the balance. A test can either be sensitive or specific, and there's a balance between the two. It can't be both, and that's always the challenge. And then we have positive predictive value. Anyone knows what that is? It's all right. All good. We're just getting warmed up. We're getting you familiar with some questions. I do not expect correct answers here, but as long as we can keep it interactive. Okay. All right. Well, a positive predictive value means if my test tells me that you're sick, what are the chances that you're actually sick? Okay, so close enough, Sarita. Yeah. So here, if I take the test from everyone, from my sample, the test will tell me 60 people are positive. But how many of them are actually positive? 40. So my positive predictive value will be 40 over 40 plus 20. So 40 over 60. Pretty good again, okay? And what is my negative predictive value? Well, it's going to be if my test says you are disease-free, what are the chances you're actually disease-free, right? So if my test tells around 200, 340 people that they're disease-free. So but actually only 180 of them are disease-free. So that's also the calculation that needs to be done here. So 180 over 180 plus 160. Again, you can also just memorize the formula, but questions like this are actually not that common on ADAT. They're not going to give you a question where you just knew the formula, you're going to plug in the numbers, get the answer, bam, you have the answer. That's not going to be the case. They want to know if you actually know what these things mean, right? I just want to clarify that. The whole purpose of me putting these questions here is to clarify that. Okay. We're on schedule. I think we'll have time to do just a few more questions. All right. The scatter diagram below shows the correlation between years of dental experience and annual income for dentists in Toronto, Canada. The correlation of years of experience to income is closest to which of the following numbers? What do you think? Just give me a guess at least, or what do you think the answer is here? This is a relatively easy question, I would say. Yes, Dr. Sarita. Thank you. All right. Yeah. So pretty easy. Once you have that upward going correlation, that means it's a positive value, meaning the higher your years of experience, the higher your income, hopefully. And then why is it option C and not option D? Because you see how these dots are really close to each other? If they were all scattered around, then it would be a lower value, somewhere around 0.2, 0.3, but we are almost close to 1. Like you are able to draw a straight line through all of these dots here. So it's almost 1. I would say 1.9 is pretty accurate. Again, it's more assessing if you know what these things are, if you know these concepts. Okay. All right, let's do one more. I think it's going to be our last one. A 5-year study is planned to assess the incident and causes of temporomandibular joint disorders in 600 dental students who report bruxism. The study consists of 2 groups. One group regularly uses night guards to prevent bruxism or teeth grinding, while the second group does not use any protective device. At the onset of the study, clinical exams and questionnaires will be performed. Which of the following best describes this study design? Amazing. Yes. Okay. I love to see some interaction here. Thank you, guys. Yeah. I'm pretty sure that we have extensive sessions on biostatistics in the Confidentist course. I talked to Ali Rizzo to make sure that it receives enough attention in our course because it's important because yes, there's only 40 questions on the topic, but they're not easy questions and they're not questions that you can just do some sample questions and answer. So this would be a little bit on the easier side of things. I didn't want to disappoint you guys by putting all like difficult, challenging questions. But yeah, answer A is correct. And it's because we have a group that is doing something and a group that's not doing something, and then we're following them over time. It is not a clinical trial because we are not clinically intervening. They're already doing something without our intervention. We're not controlling for the test and the control. We don't have a test and a control. We're just following them over time. So it is a cohort study. Yes, it is a prospective cohort. Yes, night guard is something they use, but we haven't given them the night guard. They're already using their night guards. Okay. All right. We could probably do one more. I do want you guys to see more questions, but I also have to manage our time. Let's do one more. Here. A new dental tool is introduced to measure gingival pocket depth in patients. The gold standard for measurement is 3 millimeters, meaning we have used our gold standard tool and we have measured the pocket depth to be 3 millimeter. The new tool is tested on multiple patients and the following values are recorded: 5, 4.8, 5.2, 5, and 4.9. What can be concluded about this new instrument? Is it accurate? Is it precise? Is it both? Is it neither? Or maybe we can't even say based on what we have. What do you think? So I have a picture here, really summarizes these two. Yes, it's giving higher values than the 3 millimeters, right? So if we have a test that's accurate and precise, which is what we want ideally, it's going to give us numbers that are close to each other and are also close to our target. So our target here is 3 millimeters. If it was an accurate and precise test, it would give us 3.1, 3.2, 3.3, 2.9, you know, all close to each other and all close to the target. If it's neither, then it would be, the numbers would be all over the place and none of them would be close to our target. What is going on here is that the numbers are really close to each other, almost close, but they're not close to the target. So yes, this is a precise test, but it's not accurate. So option B would be correct. All right. Let's do one more. All right. A group of researchers tried to assess the relationship of birth order, first, second, third, etc., to the association of having a child with cleidocranial dysplasia. Let's not get into details of whether this is even related to birth order or not. Let's just focus on the biostatistics part of the question. Based on this information, which of the following would be introduced as confounding bias in this situation? So you have a couple of options here. What do you think? So again, we're trying to find out if birth order is associated with cleidocranial dysplasia in the newborns, right? But what could be the confounding bias here, the confounding factor here? Okay. All right. So again, this is really a good question. I like it because confounding bias, confounding factor, is something that can be affected by both our independent variable and our dependent variable, right? So, sorry, could be affected and affecting. I have to correct that. So in here, obviously birth order is your independent variable, right? And the frequency of cleidocranial dysplasia is your dependent factor. If you think about it, mother's age is affected by both. So mother's age, like if the third child is born to a mother that's older than the first child. So the birth order and mother's age are associated, and then mother's age could actually impact the cleidocranial dysplasia. So that's the confounding factor here. Yes, genetic loading of the mother can have an effect, but does genetic loading of the mother change with the birth order? Not really. The researchers' preconceived idea of the outcome is a confounding, is a bias, but it's not a confounding bias. It's another type of bias, which we'll get into in details later. And then outcome of cleidocranial is our dependent variable, is what we're measuring in this study. Alcohol use or smoking, also these are our other factors that we have to account for in our study, just like the genetic loading, but they're not affected by the birth order. I hope that's clear, right? So confounding bias or confounding factor is something that's getting affected by both our independent and dependent values. All right, so I hope you guys learned a few things here. And I hope that that give you like an idea of what ADAT biostatistics is gonna be like. I'll leave the rest to Ali Reza. He will walk you through what Confident's course is offering you. Then I'll be back in the end for a question and answer session to answer any questions that you have.
Yeah, thank you so much, Dr. Hannah. It was so helpful materials, well organized content, and beautiful cats also. So, and please, I'll try to quickly review our package, and after that, yes, we can continue with Q&A sessions. Dear friends, for covering these requirements in ADAT, we have a new restructured course, as you can see in this slide, which can be categorized. In principle, they are two different. They are not different, but with some reasons, we categorize them in two parts: ADAT comprehensive and ADAT crash. Their differences is that in ADAT comprehensive, we have all BMS EVD and clinical science, but in ADAT crash, just we will cover BMS and EVD. That's why ADAT comprehensive takes around 4 months and crash 2 months. In the next slide, based on our time availability, I will try to quickly review in details of each package. ADAT comprehensive has at least 42 online lectures. During these days, we are finalizing the schedule and maybe it increased. However, it's the minimum number of lectures, live and pre-recorded. And as I said, it covers both BMS, EVD, and clinical science, 21 quizzes, 2 live Q&A sessions, updated booklets, 4 mock exam with discussions, private mentorship, and also membership in VIP WhatsApp group that you can join in these groups for sharing your ideas, asking your questions, with you, and create network with your other students, your instructors, your mentors. It's a valuable thing. And similar to it, and for ADAT crash, next slide, please. And yes, we have all of these services, but in different level. 20 online lectures we have in ADAT crash, 10 BMS subject-wise quizzes, 1 live Q&A session, and related booklets, also 1 mock exam, mentorship, and WhatsApp group. And practically, ADAT crash can be offered in 2 formats. One of them is this format, hybrid, and one of them is fully pre-recorded. Okay, just from this viewpoint, fully pre-recorded is a bit cheaper, but the content are the same. And it's not all the story. You can join the first session for free. It's your right to experience the teaching style and any details that you before joining the course, before committing, you want to know. It's your right. You can join the first session for free. And new service not only for ADAT, it's our private and semi-private sessions. Maybe after all of these materials, live and pre-recorded lectures, mock exams, private mentorship, still you need some specific help in, specific subjects. For example, still I need more clarification in pathology, for example, in LA, in surgery. You can book your private session with your with related instructor, and accordingly you can use this new service. As Dr. Hannah said, the date of ADAT exam is different. That's why it's our new service again, and you have access to all of materials up to end of August 2025. Okay, and from this viewpoint, you don't have any concern, and also flexible payment. You can pay in full payment or installment without any extra charge and interest. And the main part, one of the main parts at least, and we have early bird discount in each package. The normal price in ADAT comprehensive is 4,200. You can use early bird discount and you should pay 38.99, again full payment or installments. And similarly for ADAT crash, which revised price is 19.99, again full payment and two installments. But it's not endless. In the next slide, when I'm talking about, when you can see the course timeline, our early bird discount deadline is February 18. Okay, today is February 8. You can you can ask any question, and you can clear any doubts about the course. And if you decided to join us up to end of February 18, you can use these early bird discounts. Our course will start the first week of March and will be finished on first week of July. Okay. And that's all. I think we should save our time to answer your questions. However, to support your friends better, today or tomorrow, I will temporarily create a WhatsApp group and join all of you here. I share the link of this webinar, pre-recorded version of this webinar. You can review again. And also, if you have any question about the course, you can ask in this group and we will answer. Just mention us. If you have any question about technical question you can mention Dr. Hannah, and for the rest, me. We will answer, and it's temporarily. After that, the early bird discount, it will be demolished. Okay, thank you so much, and we are waiting for your questions.
Yes, Ali Rezos, there are a few questions that I'll leave it to you. They want to know if there's an option for mocks only.
Yes.
Okay, so they can message you later to know the details of that.
Exactly. In our website we have. However, I will help you to find it and register for mock only. Yes, we have mock only in ADAT also.
And they're asking if the ADAT crash course is more suitable if they've already taken the AFK course.
But really, I'm not eligible for any technical question about correlation between AFK and ADAT, which of them is better. However, it's our option. I think the first part is related to you, as I understand the question.
And then they want to know why we have one mock instead of two in our crash course. Can we add the mocks?
Based on requirements of EBD, and it was enough in these three courses that we had. One mock was enough, but we have more quizzes in EBD. Okay, it was not a structure of the course. However, in these days we are finalizing. Maybe we increase another mock in EBD. However, up to now we have these services. Yes, Steven.
All right, guys. Any questions regarding ADAT exam, ADAT preparation, anything that I can answer? Here's another cat for you.
Yeah. Several version of cats also.
I'll have to scroll
Good.
up for your question, Paradise.
Yeah. Also, Paradis has one
Yeah.
question at the first of.
Yes. Okay.
Yeah.
Which part should cover from our AFK notes? All right. Well, technically all of the AFK knowledge is required for your clinical sciences part of ADAT. Personally, I took AFK first and then ADAT. What I reviewed for ADAT was pathology and pharmacology information, because again, ADAT is not going to get into the details, and I already remembered most of my AFK knowledge. The parts that I had forgotten was pharmacology and pathology, and I reviewed those. So I would say if you have your Confidentist AFK booklets, they're a good resource for review. If you've highlighted them while you've studied for AFK, that's great. You can just go over them. And if you register for this course, we're also going to highlight the parts that are more applicable to ADAT. So that'll be also a review. There isn't any part that you could necessarily let go of. Like I can't say that this topic from AFK will not appear in ADAT, because there are going to be questions from every topic, from surgery, radiology, everything. But again, more focus on clinically applicable information. What I mean by that is details of dental materials is not going to be that important. That's just an example that's coming to my mind. But resto, perio classifications, perio diagnosis, endodontic diagnosis, these are all very important topics. Just ask yourself this question: is this important for me to know as a clinician in my office? If yes, then ADAT is going to ask that question about it. Okay. How much time is enough if we want to self-study? I know course is good, but I'm asking for your personal experience. Again, the time really, I can tell you my personal experience, but it depends on how ready you are, how ready you feel. I did it in 3 months after my AFK course, but I had a good understanding of the clinical sciences that I had studied for AFK. Also, I had a good background in biostatistics, so that's not going to apply to everyone. On average, people study between 4 to 6 months for ADAT exam. Again, I'm just going to quickly go back to this slide. You need here. You're competing for here. So the more you can study, the more time you have, the better. If you're applying for UFT, which I think is the first deadline, it's in early summer, then at least you have 4 months, and that's enough time to have a good score. But you need to give it your all best. Study as much as you can every day. All right. So confused as I already started an AFK exam, so how are they related? I think I covered this already. ADAT has 3 sections. The first section, the clinical sciences, has overlap with AFK exam. The rest you need to study separately. Okay. As I understand, as it is only 1 exam, but it's up to the chance if I can join a university or not. So I should still take AFK. Dr. Noor, this is again a personal decision. If you don't want to risk it, then I would that's what I did. I took AFK and I also took ADAT. I applied for universities, but as I was applying for universities, I registered for ACJ exam just in case that I didn't get into any university, then I would have a plan B. So do you want to have a plan B or not? That's up to you. So yeah, there's that. What order would I recommend? Good question, Dr. Arya. I would recommend if you've already taken AFK, I would recommend starting with basic science, then reviewing your clinical science, and studying your biostatistics. Why? Because basic science is rote memorization. You're going to have to review those topics again and again and again and again. So the more time you give yourself to do those reviews, the better. So I would start with that and then integrate the rest. I already have ECE report from 2021. Well, if you're able to register for your ADAT exam with that report, then it should be fine. If not, then you will need an updated one. Just try and see if you're able to register. Yes, so Dr. Paradis, within that period of March to August, you're able to choose an exam date. I'll show you here. Once you're done with this registration here, you will receive an email from Pearson VUE within a couple of days. And then you will have a link and you'll go and you'll pick your venue and you'll pick your date. It's not as hectic as AFK. I know we've all suffered through that process of finding a seat for our exams, but ADAT is not like that. I know it's 2 p.m. we are running over, but I think I've covered all of your questions. For further questions, just tag me in the group. I'll be there to answer. And good luck. I'm really confident that you guys have enough time. You have the resources, and if you need our help, we will be here to help. And you got this. And that's my cat. All right.
Thank you, Dr. Hannah, and thank you, everyone. Have a good weekend.